the top story as the COVID cases have surged and spiked. While making a comeback once again, COVID spread rise in the country is a state of worry, with the total coronavirus cases in India now breaching the mark of 1,000 on May 27th. Meanwhile, a total of 12 COVID-related deaths have been reported across India. However, with mild and subtle symptoms, experts have advised people to panic, but the state to not panic. But the state has issued the advisory urging the citizens to maintain hygiene. The new variants are identified as by the ICMR as NB 1.81 and LF.7, which are currently under observation by the World Health Organization. Let's now speak to our colleagues and reporters on the ground to understand the situation as per the situation being prevailing in the state. Joining me live on the broadcast first, in fact, before that, is Dr. MC Mishra, who is a former director of AIIMS. Sir, appreciate you joining me live on the telecast as, in fact, what we are understanding of the situation that's breaking out at this point of time is the resurgence of the COVID cases. The first question naturally in this kind of a scenario is how panic all the people and in fact the citizens, the patients, the people with comorbidities should be given the rise in cases.
Thank you so much for keeping this discussion very timely. What I would say that people should not panic, but they should be concerned and take all necessary measures not to get infection from another individual. So what we were advising 4 years ago or 5 years ago, they keeping the distance, not going into the crowds if it is not necessary, using the mask, hand hygiene, all those things people should use, and we should observe around the year actually. Not only that we have surge of viral infections, then only we observe these preventive measures. Now, as far as COVID is concerned, it is a viral infection, RNA virus, like many other influenza viruses, upper respiratory tract viruses, and there can be surge in winter, there can be surge in summer of all viral infections, including COVID. And this we have discussed at length. The COVID was there, COVID has been there, and COVID is there, and COVID will be there amongst us. Sometimes it will show surge, but do not panic thinking that it will be happening something like 2020 situation where it took the epidemic proportions. It is highly unlikely that it is going to happen. Also, people are discussing whether they should get a booster dose of vaccine, COVID vaccine. So that also what experts are advising against, that it won't help immediately, because these vaccinations help well in advance as a preventive measure. So it is unlikely to help. So at best, what we can do, those who are developing symptoms of fever, headache, body ache, nausea, vomiting, loose motions, loss of smell, they should remain at home, maintain distance with their family members also at home so that they do not get infected. Although it does happen that one family member is infected, so others also get infected with the viral illnesses. And also home care, what I say, hydration, keep yourself well hydrated, take plenty of fluids of various kinds, juices, fruit juices, lassi, or whichever, coconut waters, and keep your nutrition intact. And also what we say, home care, hydration, and also hydrotherapy, what I call. Whenever you get fevers which are high, 102, 103, and not coming down with paracetamol, which is the safest medication which people should use. There is no role of antibiotics in these situations. And take rest basically at home, use mask at home so that you do not infect others also. So isolate yourself as much as possible. I think if we keep these measures, which we have started taking in hospitals also, a little bit more careful, while traveling in a cab. Also, cab driver might be having some infection, and you may
Mr.
get
Mishra,
associated.
I understand that there is in fact the same repetition of the measures that we had taken in the earlier waves as well. But the big question remains that can we consider this resurgence as the onset of a new wave or not? Because given the scenario right now, the cases are repeating the pattern that we have seen in the previous waves. And if at all this is also leading up to that point as well or not, is the understanding that I want to gauge at this point of time.
Your question is very valid, but I think neither you can predict that, or I can predict that, or not anybody else can predict that. What we can do, we can be prepared in case it takes huge proportions. But right now, what I would say, even these 1,000 patients or cases which have been detected or confirmed of COVID, necessarily not that they are only 1,000 in India. There could be 10,000, there could be 1 lakh patients. These are the patients who have been tested for viral illnesses and they have been proved to be having COVID. Many others will have non-COVID viral infection, which is also prevailing around this time. So this is very common. So I would only say be cautious, be concerned, take preventive measures. Don't get panicked that there is some kind of epidemic has come or will come in due course of time. You will see that in another 1 or 2 weeks time, it will decline. So the surge will happen and then it will decline. So that is going to be the natural history of these viral illnesses. What at best we can do, we can take preventive measures and don't get panic about this, what is happening around us. And the number of cases may increase. So don't basically get panicked because number of cases have increased. That is because more people are getting tested with fever. Those who are at least going to the hospital, many others would be at home, getting treated at home, or recovering just with paracetamol and fluids and bringing down the temperature and food at home. So I think that is what I would suggest, that most people with fever also, unless there is any concern with breathing or something, then only. And now most people will have that pulse oximeter. So you can put on that pulse oximeter, see if your oxygenation is okay, just to reassure that it's all right.
So,
And
in complete comprehension of what you are suggesting is that there has to be preventive measures, advisories need to be followed and people don't need to panic. But apart from that, in fact, what remains to be also a big concern is that despite all of these, how worried now the people should be, how worried the institutions should be, because we have seen what has happened in COVID across the globe and in India as well. While deaths are also on a rise at this point of time, does this indicate a state of worry going ahead, or the preventive measures are enough to act upon the transmission that we are seeing locally being spread right now?
First of all, whatever deaths are being reported, necessarily not they are because of COVID. COVID may be a coincidence and coexisting with other illnesses. So, as you rightly said in the beginning, that people, elderly people, very young children, pregnant women, anybody who has some immunocompromised disease like transplant, post-transplant, people take the immunosuppressive medication, or somebody is on cancer chemotherapy, radiotherapy, their immunity is down. So they need to take extra precaution. We all need to take extra precautions, so that at my age also I have to take those precautions. And so there is no need to get worried that these deaths, like 10 deaths, 12 deaths are reported, not necessarily because of COVID. As was reported even last week, that they were unrelated to COVID. So don't relate everything to COVID. And it's good to be concerned, good to be have some anxiety, but not panic that something will happen immediately. So that is not going to happen. This is something we can reassure, and I don't think the repeat of 2020 and onwards will happen. This surge will very quickly will come down, because there is a cycle of these strains, and none of these strains so far have been like Delta variant. So they are all causing mild symptoms, mild disease, getting almost all right on its own with paracetamol. So don't do a lot of medication. Antibiotics also won't help in this. So what we need to reassure the public that whatever government advisories are being issued, you follow them as far as possible, and don't travel in a crowded places if it is not necessary. If it is necessary, use mask when you are traveling in cab also, buses also, train, airports, anywhere.
All
So I
right.
think these are
All right. So, in fact, what the sense that I have garnered so far, while understanding from you how worried we should be, if we have learned the lessons well, it is going to be a situation which we can overcome and deal with ease. Thank you very much, former AIIMS Director MC Mishra, for joining me live on the broadcast and sharing your observations and take with us on Newsx. And right now, let's also take